Hey guys, it's Anna. Today I'll be discussing a key political issue affecting us as future CRNAs, and that is full practice authority. This issue directly impacts how CRNAs deliver care, how healthcare systems function, and how patients can access safe, affordable anesthesia care services. So, first, what is full practice authority? Full practice authority refers to the ability of CRNAs to practice independently without a state requirement for physician supervision. As we know, CRNAs are advanced practice registered nurses trained to provide the full range of anesthesia services, including preoperative assessments, administration of all types of anesthesia, and postoperative care. The push for FPA isn't just about expanding practice beyond our training, it's about removing outdated regulatory barriers that restrict us as CRNAs to provide safe and effective care as we are capable providers. So, why does full practice authority matter? Full practice authority for CRNAs is supported by a growing body of evidence and policy priorities. CRNAs are often the only anesthesia provider in rural and undeserved areas. Restrictive supervision laws delay care and increase costs, especially in critical access hospitals. Removing these supervision requirements reduces administrative overhead and lowers procedural costs, with no reduction in safety or quality. The study by DeLis and Cromwell, No Harm Found, analyzed Medicare data from over 480,000 cases. It found that there was no difference in patient outcomes when CRNAs worked without physician supervision, even in high risk or complex cases. There was no harm found, thus, there was no justification for mandatory supervision. As we know, CRNAs complete a doctoral level program with over 2,500 clinical hours and were trained in all types of anesthesia general, regional, MAC. We're fully equipped to handle emergencies and perioperative care independently. Altogether, full practice authority allows CRNAs to practice at the very tops of their licenses, which is exactly as what our training and outcomes support. Despite strong evidence and growing support, not all states allow full CRNA practice. Some still require physician supervision by law or facility policy. States like Arizona, New Mexico, Montana, and Iowa have granted CRNAs full practice authority. However, this progress is not even across the board. Opposition from physician groups, state and federal laws, insurance or third-party reimbursers still remain a barrier. At the federal level, there's been progress through temporary Centers for Medicare and Medicaid policy changes, such as during the COVID-19 pandemic. But permanent legislative solutions are needed in order to allow CRNAs to practice at the tops of their scopes in all states and facilities. Full practice authority is not just about professional autonomy. It's about improving patient care and modernizing healthcare delivery. We must support legislation that allows us as CRNAs to practice to the full extent of our education and training. I encourage you to get involved with AANA advocacy efforts, contact your state legislators, and educate others about this issue. I have attached the link to the AANA advocacy to locate ways to advocate for our profession within our state. Full practice authority is more than a CRNA issue. It's a patient access issue and also a public health issue. Thank you for listening to my presentation, and please reach out if you have any questions. Thank you.